the California Master Plan on Aging. This is an incredible document that will, for a decade, be the marching orders, morphing over the decades. So that's why we're having ongoing conversations within every county and with every sector. But we finally have gotten to a place that we understand that having a master plan around everything that has to do with aging is important. So would you explain to our Life is a Sacred Journey listeners, followers, audience, why this is important and why they should participate in their community and find out whether or not their state community has a master plan?
Yeah, absolutely. I mean, I think the plan is groundbreaking in the sense that it's a way in which a state can really think about the broad range of issues, realities, and strengths that older adults have in a state, and the variety of ways in which they're interconnected, the variety of ways that a state government can invest and boost. And it's also long-term and visionary. So it does lay out 10 years of work, or a 10-year roadmap, and then the first year of kind of metrics and goals and what the state should be focusing on. A few months ago, I wrote a report on how the Master Plan on Aging addresses direct care workers and the opportunities there are to really support home care workers and nursing assistants throughout the state to better deliver services and supports to older adults and people with disabilities, of course. A few points that I would make in terms of its historical nature. One is that I think it's a great acknowledgement that, we are becoming an increasingly older country. We've, many people in our field, you and I included, have been really sounding, I want to say the alarm, but at least kind of raising the flag on the idea that, we are a country where the number of people who are turning 65 is growing. Every day, 10,000 people turn 65, but also people are living longer. We're seeing now people live in their 80s and 90s. That's a wonderful medical success, and it's a great example of the ways older adults are contributing to this country in ways never seen before. But it also raises questions about, have we designed our country's system in such a way that we're adequately prepared and resourced to support older adults? And I think, one of the smartest things about this plan is that it takes a step back and says it's not about the individual silos as much. It's not about, a pocket of funding for elder abuse and a pocket of funding for workforce development and so on. It's about looking at the issue holistically. And it's about saying, let's take a step back. And it's about evaluating and setting concrete metrics that we can look forward every year and say, are we making progress or are we not? So I'm really hopeful that it kind of sets the standard for what other states do.
In the master plan, in every state it will be different, but the primary focus is around what I think is important, how we are compensating and educating our direct care workers in the elder care field. Mm-hmm. And so traditionally, we know that CNAs and home health aides and folks that work in congregate living spaces, or what I say, do the heavy lifting of the care, are the ones that make the less salary. They're expected to live on minimum wage. They many times do not have benefits and do not accumulate the type of personal wealth, I'm going to call it wealth, just to live. Usually we equate wealth with people being able to buy luxuries, but I'm going to change that. I'm talking about the true meaning of wealth means having money to cover your life expenses and to send your kids to college and buy a car so that you don't have to take public. Wealth means being able to live. So we in this country have gotten it wrong. And finally, we're saying, whoa, especially the pandemic opened our eyes to this also. How did we get to that place where essential workers were not looked at as primary care providers? And then what do you see happening to shift us to this new reality that we understand they are essential workers, just like a doctor, a physical therapist.
Absolutely. It's a great question. And it's a big question because I think there are a number of factors involved. I would start first with, the primary people that direct care workers support are older adults and people with disabilities. And we do live in a country of incredible ageism and ableism. We disregard older adults and people with disabilities in a variety of ways. And we see that, through public policy. We see that through kind of the funding of services and supports. And I think in our everyday lives, COVID-19, I think really reinforced that in that, some of the people most at risk were older adults and people with disabilities in nursing homes. That's just a great example, an unfortunate example of how we disregard older adults. So I think, in doing so, we're also disregarding the entire system and the people, the workers who support that. The other piece is that, this is a workforce that is primarily made up of women, of people of color, and of immigrants. And these are populations that have long been marginalized in every facet of American society. And when you look at the historical record on home care workers in particular, and you go back to the 1930s, where, as a country, we were debating the New Deal and which workforces should be covered by wage and overtime protections, what the historical records show is that many members of Congress, especially from the South, use these racist and sexist arguments to exempt home care workers from those protections. They argued that it was women's work and women's work wasn't as valuable, and women are innately able to do this work, so it's not really work. And a lot of the workers were Black people, Black women from the South, and it was the way in which we continued kind of slavery and Jim Crow, right? We created a workforce that was further exploited. And so I do think we're at a point where we should be thinking about how to correct those wrongs and how to really strengthen this workforce, right? And we can do that by, improving compensation, providing full-time hours, really strengthening the training system, the requirements, the funding, creating career advancement opportunities, and just generally transforming this job so that a worker sees this as a career and is rewarded for the same level of essential rewards that they're offering their clients,